Good evening, everyone, and very warm welcome to the 18th episode of Tuesday Tea Time with Dr. Kawita Bapat, ma'am.
The Learn Simply with Kawita Bapat. Welcome, Madam EVITA, Madam. It's a platform for conversation, insights, and knowledge sharing and take-home messages, especially a crisp knowledge about various subjects through the conversation with leaders and experts like you in respective fields. And the number one thing is our goal is to provide the practicing OBGYN to assess a valuable information, knowledge, and that can help them grow personally. That's my idea about it. And all of us know that Dr. EVITA Fernandez is extraordinary individual and whose contribution to obstetrics and gynec have positively impacted the life of countless women and children. Her remarkable achievements and unwavering dedication make her deserving to the highest praises, and some few accolades for Madam EVITA Fernandez. I enjoy saying EVITA because Kavita and EVITA, they rhyme together. You are a visionary leader, and a visionary leadership as a chairperson of the Fernandez Foundation has transformed the landscape of maternal and child care in India. And your forward-thinking approach and innovative initiatives have set standards in the field. You are the advocate for the women empowerment, true champion of the women empowerment, and your commitment to provide women with the knowledge and a freedom to make informed choices regarding the birth experiences really are commendable. Through your efforts, you have empowered countless women to take control to their reproductive health. You are the pioneer into the natural birthing and a midwifery, and especially you have revolutionized in this field in India. Your dedication to promoting the benefits and safety of natural birth options has helped create more holistic and empowering the birthing experience for women. You are especially the catalyst for the professional midwifery education, and you have established the India's first professional midwifery education and training, that is PMET program, is truly remarkable. Your efforts to develop national cadre of professional midwives through PROMISE program, PROMISE program campaign have ensured that the low-risk pregnant women receive high-quality care throughout their pregnancy journey. You have done a lifelong commitment to maternal and child health with a career spanning 3 decades and dedicated your life in the well-being of mothers and children in India. Your unwavering commitments and tireless efforts have saved countless lives and making a lasting impact on the healthcare system. And the most important point is that you are the inspiring role model and inspired many aspiring medical professionals, especially women. Your achievements, your expertise, your compassionate approach is remarkable and a benchmark excellence in the field of OBGYN. And the last and most important, you are the advocate for the safe and the holistic care, and that this advocacy contributed significantly to improve the overall health outcomes of the women and children. So, Madam, especially all your contributions are transformed in the field of OBGYN. At least a few things which I can learn from you: the advocacy, the inspiring, the lifelong commitment, the catalyst for the professional this thing, and yes, you are a pioneer. I'll be happy and welcome you to this program of Tuesday Tea Time. We'll just discuss just for the opening remarks you start with, and then we'll have a set of questions which will talk about what is the future of midwifery in India. Welcome to the Tuesday Tea Time.
Thank you, Kavita. And to begin with, my God, you read so many things. I was embarrassed. You're very, very generous with your introduction.
You deserve it. You deserve it.
I'm embarrassed, but thank you. Come on. Thank you very much. But it's an honor to be here with you. Thank you for inviting me. Yeah. Go ahead.
Yeah, so we can start with simple questions, and that questions are really simple because it's for a general OBGYN and a practicing OBGYN all over India. And basically it's not, it's a very simple things which you have done and what you have done, how you have approached. But for just making people understand, midwifery will start with what is midwifery. Everybody knows it, but you can put it in your words as well as what is the current state of midwifery in India.
Sure.
Are we up to mark or not, or where we are?
Mm-hmm.
That's what. Yeah.
So let's just start with the basics, Kavita. The word midwife is an Anglo-Saxon word. Yeah. It means with woman. And that's essentially what a professional midwife does. She walks with the woman right from the time she's, pregnant to her labor, childbirth, and 6 weeks after she's given birth to the baby. She's more or less her, not just a trusted companion, but a competent professional responsible for 2 lives. So when we use the word midwife today, sadly, a lot of people connect it with the traditional birth midwives. That's not the connection at all. Today, when we use the word midwife, we're talking about an accountable, highly skilled, competent healthcare professional. And I would say a colleague, not a haath ke niche for the obstetricians. So we kind of work together and we complement each other. Now, the difference between a midwife and us is the midwifery philosophy rests on one simple fact, that women's bodies are built to give birth.
Yes.
And all we need to do is support them and recognize if there is any deviation from normality.
Yeah.
So midwives are trained to take care of healthy women. And we know that they form the larger part of the pregnant population.
Yes.
So a healthy woman is very, very safe in the hands of a midwife who is trained to global standards.
Yes.
And research has shown that enough.
Absolutely. It's really in a nutshell, you can say, though the person who can support the women in a positive and a safe way, as you have said. Now, would you like to talk something or some important points that what are the exact benefits of midwifery we can have in our country? Like, what are the absolute? See, you are very nicely said that the previously when we were students or when we have seen the home, the dai used to be the word, but now with revolutionizing the things which you have done. Now, can you just tell me what are the exact benefits of midwifery?
Yeah. So I'll just rewind a bit and say that if you look at countries like Sweden, they've got a 400-year history of midwifery. UK has a 200-year history. So midwives work with women, all right? Now, let's take a high volume hospital. And you've got a mix of, I'm using the word patients, very with a lot of hesitation because we call them mothers or pregnant women. So let's take a mix of pregnant women in a high volume hospital, most of our public hospitals. Now, if you have a group of professional midwives in this setting, they can take care of all the healthy women, run the antenatal clinics, so the doctors can focus on mothers with complications. So you have your undivided attention and you're looking after these mothers. So you don't have to worry about the low risk pregnant women. So that's one very huge benefit. Then the midwife is trained to recognize warning signs. So she says, oh, this woman has a lot of edema, or she's gained a lot of weight. She checks her BP, picks it up, does a urine albumin, looks if there's protein. Then she'll straight away tell the obstetrician, ma'am, we've got a problem here. This is what I've done. And then you have collaborative care. The woman is taken care of quickly. So you prevent morbidity and, of course, mortality. So their expertise and normality, they pick up even slight deviations from normal. The main thing, they don't interfere when a woman is in labor. So you'll never hear of midwives inducing labor unless there's an absolute indication. Just to watch a woman enjoy an uninterrupted labor and birth is a wonderful experience, which we hardly see today because we're constantly interfering. We're either doing an ARM or we're starting a Synto, let's speed up the birth. We've got 2 more women in labor, we need the beds. So it's almost like a conveyor belt environment. And that's because we've got all these constraints that we are working with. But if you create a space for the midwives to work, they just take care of these women. We don't need to worry. And we can take care of the high-risk mothers. Absolutely. So there's this tremendous, complementing each other's strengths. Mothers are so happy because here is a midwife assigned to her. She's listening to the woman. She's giving her the respect, the privacy, the dignity. There's no verbal abuse. There's no physical abuse because the heart of midwifery rests on a simple fact that woman is at the center of all the decisions.
Amazing.
So women just love it. Kavita, today in Fernandez Hospital,
Yes.
the low-risk mothers have to wait at least 2 weeks to get an appointment for an antenatal visit with a midwife.
Amazing.
We don't have enough midwives for the volumes that we are serving. But if you go to the district hospitals of Telangana, where you've now got about 215 qualified midwives who've gone through 18 months of training, and they are posted in clusters in district hospitals, your heart will be filled with joy. Because you see these midwives now working along with obstetric champions. So they're helping in the antenatal clinics. And when these women come in labor, these midwives are also taught to birth women in different positions. So you've got women birthing in squatting position, in the left lateral position, in the standing position, in the knee chest position. You've got gym balls and a rebozo, a strong string where the woman can hold and she can sway, and that helps her handle pain. You've got women with birth companions. In some district hospitals, husbands are coming in to help their wives. I mean, the scene has changed.
Amazing, amazing, revolutionized.
And when you hear the midwives tell you their stories, this one woman, she was so moved by this care. She caught hold of the midwife's hands and kissed them and said, I've never experienced such respect and care. And you and I don't have the time to be with a woman for 6 to 8 hours, supporting her constantly. So when you've got a professional colleague who's trained, whom you can trust, and who will inform you on time because you've got this amazing mutual respect and trust, what better partnership can we ask for?
Amazing. The way you have put the words, all this really, I'm feeling like just what to say. But basically this personalized and holistic care and the love and the focus on the mother, especially on the low resource settings, what we are having. But exactly, madam, what challenges we are facing for midwifery in our country? That's, I think, your model should be a popular model, and a popular model is. But being a Foxian and everything, I feel still we have many challenges. So will you like to talk something, this challenge we are facing in India for midwives?
It's multi-pronged, Kavita. It's not just one challenge. I believe the biggest challenge is fear and ignorance to a certain extent on the part of us, the obstetric fraternity. If I've never met a midwife who's trained in this manner, if I've never watched or worked with a midwife, then I have fears because in my mind, arey yaar, she's a nurse. What is she going to do that is so different from what I'm doing? These are fears that we all worked through even in Fernandez. It took me 2 years to convince my colleagues. And today they say, my God, how did we work without midwives? Okay. So it's that initial fear that we need to work with. Second is we must be sure that the quality of training of that nurse into a midwife is high quality. We cannot compromise. We can't bring the bar down. It has to be global standards. The third thing is, and I don't have an answer for this, Kavita, because in Fernandez, all of us were on salaries. We were not linked with, if I do this delivery, I get paid. Not at all. So it didn't matter for us working with midwives. What mattered was, were we doing the right thing, making the right decisions? Now, in the outside world, if an obstetrician is earning her money every month based on every delivery she conducts, then I'm not sure how this brings in the professional midwife into the environment. We need to work some other way of payment. I don't know the answer for that at the moment.
Yes.
In the government hospitals, in the public hospitals, Telangana has created special posts for midwife.
Yeah.
Because one of the important things, remember, Kavita, this nurse has changed her profession.
Yeah.
She is no longer taking orders.
Yeah.
A nurse takes orders.
Yes.
A midwife takes charge.
Integrated.
She's working with the woman. She's helping the woman make decisions.
Right.
She's telling the obstetrician, doctor, you need to come now. This woman is not going to birth. I need your professional advice. Maybe she will need a forceps or a C-section, but this is your call.
Yeah.
I know that beyond this, I won't be able to help her. Now, that kind of a partnership, who benefits? It's the woman.
Amazing.
The woman and her baby.
Yeah. So the challenges you mean, number one is lack of recognition of profession.
Yeah, because see, if I don't know what a midwife is, I won't have those fears.
And the second is the education and the training opportunity.
The quality of training.
Yeah.
And the third is there's a very clear margin, Kavita, for a midwife to work on.
Yes.
There's very, very strict criteria. You have to risk categorize the mother.
Yes.
If she does not fall in that category, the midwife cannot take care of her.
Right.
She has to be under the care of an obstetrician. So there are many, many safety factors.
So it's an integration to the healthcare.
Absolutely. Absolutely. It's integration.
And the more important, we need more research and data.
Yeah, well, all we need, I believe, if we can find obstetric champions everywhere, if there's one obstetrician who's willing to say, Arey yaar, let me see what this is all about.
Yeah.
Once she gets convinced, then she can talk to her other colleagues. It's that initial fear that we need to overcome. Then you don't look back.
Okay. And same with another question which comes in our mind, or we can say, what all these initiatives to promote midwifery in India? I want the answer in two parts, like what we as obstetrician are doing and what government is doing. What is the government helping us in doing this?
Subject? So there are 3 areas. In fact, there are 4 areas. First, let's talk about the government, Kavita. Government is absolutely convinced we need midwives and they have to be integrated into the maternity services across the country.
Absolutely.
So they have decided that all the Lakshya certified hospitals, we will introduce midwifery-led care clinics, where again, there you will risk categorize mothers and the midwives will take care of them and work along with the obstetricians, offering collaborative care. So we have now 14 national midwifery training institutes across the country, training educators, and then we have state midwifery training institutes across the country, training nurses to become midwives. So we have 2 streams of training happening across the country. So the government is very committed. Okay. We ourselves at the Fernandes, we are a national midwifery training institute, have trained 78 MSc nurses as future midwifery educators, and these have come from 10 states across India. So they go back and in turn train midwives in their state. That's just an example of how it's working. So that's one part. The second part is there are obstetricians in the private sector and in the government sector who have now recognized that, yes, midwives should be part of our system.
Yes.
And it's these obstetric champions who will play a big role in changing the scene. If we obstetricians can open our hearts, our minds, and say, hey, come on, let's work together, a huge breakthrough will happen.
Absolutely.
Kavita, today, Fernandes Hospital is birthing 11,000 women every year.
My God.
And I tell you, it is not because of just the obstetricians. It's because of the collaborative care that you have midwives and obstetricians working together.
Yeah.
That's the result. And this is what India needs, that collaborative model
Yeah.
where a complicated pregnancy is handled by an obstetrician with the midwife supporting her during labor if she needs it.
Yeah.
And a healthy woman being handled by midwives.
Yeah.
The third thing is policymakers, Kavita.
Yeah.
So, the policymakers also feel it is important. And that's why I'm hoping Foxy will get involved and support the program.
Yeah.
Finally, and I believe this is going to be the most powerful weapon, the women are beginning to ask, Kavita. The women are asking for midwifery care.
Absolutely.
Today, we get phone calls from women who say, I want an appointment with a midwife. I don't want to see a doctor. I want to see a midwife. I mean, it's changing.
Yeah.
Women are beginning to say, I want a natural birth. I don't want to be induced.
Yeah.
I'm healthy. You give me a reason. Why should I have this? I mean, people, women, and again, you will see, we started childbirth classes in public hospitals. The midwives collect women, say in groups of 10, sit with them and talk to them about labor, birth, tell them how to handle pain, teach them exercises, get them to sit on a gym ball just to see, how do you sway, how do you handle pain.
Yes.
These women are so empowered, Kavita. We are talking about women in our district hospitals, public hospitals. They come in with such confidence. And when they meet the midwives, if they have met them in the antenatal clinic, there's continuity of care.
It's good.
This, your normal births start increasing. So if you look in the private sector, your costs for running a maternity service come down.
Yeah.
Because your C-sections come down. Your need for operating theaters come down. Ultimately, the mother is getting the best care.
Absolutely.
And when you do that, your numbers will start increasing. Because one mother goes back and says, hey, you know what? I went there and I actually had a normal birth.
That's
what better endorsement do you need?
Absolutely, absolutely. You mean that all the initiatives promote midwifery is good? Good government should work on it. Another most important, we as a thing we are doing it, and policy making is also important. That which you have talked about, and the most important, we should have the awareness into general public that they want midwifery in this. That's very, very important.
Because those voices are getting louder.
Yeah. मैं क्या दूंगी उससे ज़्यादा है मेरे को क्या चाहिए? Am I right, madam? That's in Hindi we can say like this. Yeah. So, madam, just to it's a question, simple question. What education and training basically be required? Because become the wife in India.
Yeah. No, thank you. Thank you for that question.
It's a very respectful profession if we want to make it. And it should be a very recognized profession.
Absolutely.
Everybody wants to become lawyers, engineers, and whatnot. So it's better if somebody wants to become it should be glamorized, madam. Don't you think?
It should become aspirational.
Yeah.
It should become aspirational.
Yeah.
And a lot of that depends also on how we
अंदर से आना चाहिए that I want.
Yes.
Same like our profession.
Yes.
If you really think that this what we are doing with a passion, then the things changes. Same.
Absolutely. Yes. So the basic qualification, you have to be either a general, a GNM, a nurse who has done 3 years of diploma, or a nurse with a BSc qualification. So that nurse can join the Indian Nursing Council curriculum of 18 months. And at the end of 18 months, it's a very, very focused training. She appears for an exam, and then she gets a certificate, which is called, which puts a title of nurse practitioner in midwifery.
Okay.
Then she has the medical legal backing of running antenatal clinics and looking after women, but the Indian Nursing Council has not given her the scope of practice to admit a mother under her care.
Okay.
Today, no midwife can admit a mother. She will admit a mother under the care of an obstetrician. while
she should be initially with some obstetrician also. It's a general question.
We obstetricians should at least give them that support medico-legally.
So, for example, one person is a midwife. She is not allowed to practice as her own, but she can tell that I am under such and such obstetrician.
Absolutely.
Under such and such hospital.
Yes. Because that's what all our midwives at Fernandez, they are under the protection of the banner of the hospital. And you have to be qualified. You're not just going to take anybody and say, okay, she's a midwife. No, they all have to go through this. And that's why, Kavita, it's very, very important. Our standards are high.
Yes.
We cannot afford to settle for mediocrity. Don't we aim for high standards for ourselves?
Yeah.
So
if you have our patients.
Exactly. Yeah.
Exactly. For everything in life. So this is just a concluding questions which I like to say. So in a two way you can put it. Does it this midwifery will improve the maternal and neonatal health? Definitely, as you'll like to speak on it. And what exactly we can see in 5 years where midwifery in the future of this country, where we can put it with all your efforts and many more things, and how you see the future of midwifery as well as how we improving the
Thank you. In 2014, Lancet brought out a series of articles. In fact, there were 3 issues dedicated to midwifery. And the research was groundbreaking. If a country invests in midwifery and forms the backbone of its services, 85% of maternal and newborn needs are met.
Yes.
So this alone reduces morbidity and mortality. The research is absolutely there. We don't have to doubt it.
Yes.
The only thing we need to do is I'm talking about the obstetric fraternity, needs to overcome our natural fear.
Yes.
If we can just overcome that fear, it will open up a whole world, not just for ourselves, but for the women whom we serve.
Yes.
In 5 years, I expect a lot of our public hospitals across the country having midwifery as clusters in their units. I also expect private hospitals to have midwives because more and more women are asking. At Fernandez, we've had requests from quite a few private hospitals asking, can you help us? Can you help us, set up midwifery? Can you send midwives? And I suspect the stimulus is the women.
Yes.
I suspect the women are coming to the hospitals and saying, can I have a natural birth? Do you have midwives? Can I have a water birth? So it's changing. And we need to listen to the voices of these women.
Absolutely. Amazing the way you put it in such as a growing recognition, I think.
Absolutely.
The importance of midwifery and especially the improved maternal and neonatal health. We are promoting.
There's no doubt about it. Yeah.
The government organizations are there, non-government organizations are there. Everybody, I think they will work and demand of midwives will increase. So nice, madam. Thank you so much for joining today. And I'm really privileged that the future of midwifery of India looks, it's a going recognition as a need. A skilled birth attendants are very, very important.
Yes.
And it's a very with increased investment in a midwifery education and training, I think, and a greater integration with the midwife healthcare system. It is going to play a very important potential role in improving maternal and newborn health in our India. Thank you so much.
Absolutely. So, Kavita, I hope Foxy will back it also. Thank you. Thank you very much
for joining. Thank you so much.